Well, good afternoon. Thank you, everyone, for joining us. A little bit of housekeeping again. If you do have questions, please jot them down on a piece of paper, and you can ask at the end for those of you who are joining us live today. And for those of you who are joining us virtually, please put your questions in the chat. That will come directly to us, the presenters, so we'll be able to address those at the end as well. So I'm happy to join the team here at the Ear Research Foundation and Concierge Hearing Devices, which is a division of the Ear Research Foundation, to provide some new information regarding the EarLens technology. Concierge Hearing Devices, which is a division of the Ear Research Foundation, works with patients to provide the best hearing solutions to meet your needs so that you can enjoy better hearing in your daily lives. Today, we're going to be talking about the EarLens contact hearing solution. The presenters today, you're going to be joined by myself, Ken Marvel. I work with EarLens. I'm based here in Florida, and I work with ENT providers and support the needs of patients throughout the state that are fit with the EarLens contact hearing solution. And our lead presenter today, who's going to be joining us as well, is Dr. Jack Wazen. Dr. Wazen specializes in otology and neuro-otology and is dedicated to the treatment of hearing loss and balance disorders. He performs advanced microsurgical procedures on those with complex cases of hearing loss, and he also specializes in the medical and surgical treatment of sinus disorders, as well as the surgical removal of acoustic neuromas. So since you're attending our webinar today about a new hearing loss treatment, you're probably interested in finding the best solutions to help you understand speech more clearly and to enjoy other hearing situations like music and nature. And to be honest, you're not alone. More than 44 million adults in the United States suffer from some form of hearing loss. Bear with me here just a moment. We're just getting this back into the mode that we want to see it in. There we go. So, what kind of situations can be frustrating with hearing loss? There's many situations where it can be frustrating to not be able to hear clearly. For some of you, it might be difficulty understanding voices in noisy environments, especially in noisy situations like restaurants or group settings, sitting around the dinner table. When there's lots of different voices going on, this can be very difficult and challenging. For others, you might be feeling that you're not hearing a full and rich and natural sound. So I want you to think, as we go through the presentation today, think to yourself of some situations where you yourself are not really experiencing and enjoying the listening environment, whether you're using traditional acoustic devices currently, or if you haven't yet made that decision to accept amplification as a treatment solution for your hearing loss. So a surprising statistic, even though these listening environments can be very frustrating, challenging, exhausting for patients who suffer from hearing loss, about 80% of the people that could benefit from treatment treatment by amplification accept amplification. It's about 80% haven't made that decision to move forward. So So even though it's frustrating and not to be able to understand speech and hear clearly, it's difficult for people to make that step to move forward. So we want to give you as much information and education on the technologies that can help, and to create a situation where you can hear in a much more comfortable and higher quality listening experience. So the number one reason that patients don't accept amplification and move forward, whether they're new to technology or existing users looking to upgrade their technology, is poor sound quality. So first, before we move on and talk some details about this, I have a question for you. So how many of you are wearing hearing aids but still experiencing poor sound quality? I see a lot of hands in the room. You know, you're not alone. Many patients report that they still want more from their hearing loss treatment solution. And that's why EarLens was developed. So EarLens was specifically developed with one goal: to improve the sound quality that hearing aids can provide. And that's exactly what we've done. So EarLens uses a tiny lens placed in the ear to directly vibrate the eardrum. This is a completely different approach than traditional acoustic devices. Because of this unique way that EarLens delivers amplification, it allows us to provide 2.5 times the bandwidth of a traditional acoustic device. So let's watch this video to learn more about how the EarLens system works.
The EarLens hearing aid has 3 major parts: the processor, the ear tip, and the lens. The small custom-built lens is placed in the ear by an ENT physician in their office and gently conforms to the eardrum. The custom shape of the lens keeps it in place during routine activities like showering and sleeping. The rechargeable processor captures sound through the microphones and communicates it to the ear tip, which converts the sound into pulses of energy. It signals the lens, which gently vibrates the eardrum to activate your natural hearing system, just like in normal hearing. EarLens can even connect to your smartphone. You can take calls and stream music directly through your hearing aid, and use the EarLens app to discreetly adjust the volume and programs on your devices. Experience richer, more complete hearing with the EarLens hearing aid.
So now that you understand how EarLens works, let's talk about what a lens can actually do for your hearing. So if you've been tested for hearing loss, you've probably received an audiogram. And when you had your hearing test, your audiologist or hearing instrument specialist would have gone over that audiogram with you to provide information based upon your specific hearing loss type. So if you look at this audiogram, this is a pretty popular type of hearing loss for patients. Audiograms show how loud sounds need to be in order for you to hear them at specific frequencies. So looking at this graph, you can see at 500 hertz, a patient would sounds that are softer than about 35 decibels would not be able to be heard by that patient. And if you look at 4,000 hertz, sounds softer than about 65 dB would be difficult or not be able to be heard. So sounds above this line would not be audible, and sounds below you would be audible. Now, if we compare that to like a keys on the piano, so you can understand this, we have low frequencies on the left side, and on the right side, we have the high frequencies. High frequencies are sounds that are going to be like birds chirping, or cymbals, or certain speech sounds. And sounds off onto the left are going to be low frequency sounds. So in this graph, what we've done is we're showing you an area where normal sounds are being heard. So this is things like normal speech, louder speaking. And if you look at this, a whisper would be kind of in the 30 decibel range, and somebody speaking with a loud voice, like myself today, would be somewhere around 65 dB. So if we look at another image to further describe this, the sounds that occur in the dark blue section, this person with this audiogram would not be able to hear those sounds. Sounds that are in the light blue section would be audible for this patient. So do you know which sounds might be at some of these frequencies? So let's take a look. So looking at this next graph, this shows you some of the chart. This chart shows which letters or which speech sounds are going to occur at which frequencies. And one of the things to consider is when we speak or we're listening to speech, it's not just one frequency that's coming through. Like if you took an equalizer on a stereo and turned everything off and just had one frequency. It's a mix of frequencies, so to make speech clear. If you look at the graph in the dark blue section here, you'll see the sounds like TH and Fs and S's, Ks and Ps, all of these consonant sounds which make speech clear and able to be understood. And when we're looking at these sounds, if you look at the low frequencies, you'll see things like Ns and Gs and Ls and Rs. So if you're having difficulty hearing some of these sounds or some of these frequencies, it can make it very difficult for your brain to understand what you're hearing because you're missing some vital information. And a way to further show this is one of my favorite game shows of all time is to look at this, and when we hear those sounds, you may not be picking up all of the sounds that you need to hear. So when you look at this, this could be understood as 53 and funny, like a joke, or 63 and sunny, like beautiful Sarasota today. And I will speak. I got a message in the chat to try to speak a little louder, so I'll get a little closer to the microphone. I hope this is better. Please let us know in the chat if you're hearing us better. Thank you. So I'm going to show you another example through a spectrogram that allows you to see and better understand all of the different frequencies that occur in speech.
It may be a new concept to you that different speech sounds have different frequencies, which makes some sounds harder to hear than others. But you can actually use a tool called a spectrogram to show how different sounds occur at different frequencies. First, let's look at words that contain more low frequencies and may be easier to hear. Words with lots of vowels like bunny, now, and dollar. Now let's look at some words with high frequency sounds that people with hearing impairment may struggle to understand. Words like cat and cap, first and thirst, or wisp and wish.
And forgive me just a moment. We've got something here that isn't right. Okay, now we're back on. Thank you. So this is something I'd like to ask Dr. Wazen to contribute to the discussion on. And this is specific to, hearing all of the sounds that are important to give you information and be able to understand is important for your brain health. And the brain has to work harder when you're not hearing all of the frequencies. This can cause cognitive overload in the areas of the brain where you process short-term memory and can actually be linked to dementia. But I'd like to have Dr. Wazen speak a little bit more about the importance of those sounds for as far as with your brain health and understanding speech.
All right, thank you, Ken. Thank you for those attending in live. Those of you attending virtually are missing a wonderful lunch here. Wasn't that good? Yeah, I usually do not eat that much for lunch. Anyway, so the idea of better hearing is what we strive for. And the purpose of our institute, the Ear Research Foundation, the Silverstein Institute, all founded by Dr. Herb Silverstein, who is sitting right there, is to promote better hearing, better balance, better health when it comes to hearing and balance systems. So, and one of the ways we achieve that is to be always on top of all changes and new developments in the technology for hearing advancement. So the ear lens, as Ken described, is one of the latest ways to enhance hearing when hearing aids are not enough. And there's a range of things that we do. We do hearing aids, we do ear lens, and when the ear lens is not enough, we do cochlear implants, we do bone conduction implants. All of that is a spectrum of things that we can choose based on your individual needs for what you need to do to hear better. Why do we want to hear better? Now, Ken mentioned the brain and the brain health. And that is very important for people who are procrastinating about hearing to understand. So our normal hearing starts at the ear level, and it has to be conducted to the brain. And in the brain, there is the central hearing system, which is in the temporal lobe, and the temporal lobe is right here on the side of the brain. The temporal lobe is where sound gets interpreted by the brain as speech and sound or anything you hear. So when one has normal hearing, the hearing goes through the ear, through the nerve, to the brain, to the temporal lobe, and you hear. You don't struggle to hear. You don't fight to hear. You hear. People who have hearing loss of different levels, particularly in the high frequencies and when they start losing hearing, that ability to understand speech diminishes. So, as you were told earlier, Ken said all those consonants in speech you cannot hear. So now you're trying to think and process sound through your frontal lobes, which is the center of thinking and analysis. It's not the center of hearing. We don't hear from our frontal lobe. We hear from our temporal lobes. But when the temporal lobe is not receiving that information, then the frontal lobes now are trying to guess what the word is, try to fill in the blanks, try to put it in context of the conversation so you understand what's being said. And all of that takes energy out of the activities of the frontal lobe, which is more analysis, memory, and problem solving. So you're problem solving to hear instead of hearing automatically. The other important thing to also recognize, which I don't think a lot of you know, and we've learned that through MRIs of the brain, once the temporal lobe is not receiving the stimulation, which is the information that's coming from the ear, from the outside, that space in the brain that is not being activated becomes invaded by surrounding functions. And the most important surrounding function is the visual function. So the visual center, which is in the back of the brain, now enters and takes over the hearing compartment and sits there and takes over. Now, 5 years later, somebody says, you know, now I'm ready to get a hearing aid. So they get the hearing aid, but there's nobody there. There's nobody at home to take that information because the temporal lobe has been replaced by other functions. Keep going. I'm still soft. I'm speaking at the top of my voice. All right. So you understand what I'm saying? So you need to continuously stimulate your hearing center with proper stimulation and proper sound. Whether you do it with your regular hearing aid and you're happy with it, fine. But if your regular hearing aid is not doing the job, you need to upgrade to something like the ear lens. And I think Ken will come back to proceed to tell you that those high frequencies are not reached by your conventional hearing. So when you have a steep high frequency hearing loss, your classical hearing aid cannot get you the volume you need in those high frequencies. So this is the system that does that. Do you want to take it from here, Ken? Or?
Yes, thank you, Doctor.
Okay.
So like Dr. Wazen said, absolutely, the full range of sound helps you gain the best speech understanding. So let's look at a traditional acoustic device so that you can understand and see how that system functions. Because traditional acoustic devices, the physical components haven't changed that much as far as how they function. You have microphones which receive the incoming sound. You have that microphone converts that over to a digital signal, which is then driven through a speaker that amplifies those sounds down the patient's ear canal to vibrate your eardrum. So when you look at an audiogram, like we were looking at earlier, and you see some of those same speech sounds in this graph, you'll notice in the dark blue section, the green area that's right in the middle, that's about the area that a traditional acoustic device is going to be able to amplify. All of that dark blue that's above is not able to be reached. So in order to get the best hearing, studies show that you have to directly drive the eardrum with a lens. And EarLens is the only company on the market that does that. So when we look at that same graph with an EarLens device, the green section is what the EarLens system is able to amplify to. So the majority of those speech sounds, which were not able to be reached by a traditional acoustic device, are able to be reached here. EarLens uses a small lens placed directly on the eardrum to vibrate and activate your natural hearing process. By sending the information directly to the eardrum without using a speaker, you get more complete sound than with any other system. And it also allows you to the system gently vibrates the eardrum to do that. So it's directly driving it. So we're not trying to create a simulated acoustic signal down the ear canal. We're actually directly driving it using your natural hearing system. What all this means is that EarLens delivers a broader frequency range than a traditional acoustic device that is going to deliver a much more natural sound quality and better speech understanding in noisy situations. And you can see here on these bars the difference in the bandwidth performance. So a peer-reviewed study conducted by the National Center of Audiology showed that EarLens allows you to better understand sentences in situations with louder background noise, and you will more accurately recognize the consonant sounds that are critical for distinguishing words. And this is one of the reasons that EarLens was awarded one of Time's best inventions of 2020. So in order to really hear the difference, let's listen to this comparison video that shows how EarLens sounds versus traditional acoustic devices.
EarLens uses revolutionary technology to directly vibrate the eardrum. giving you dramatically better hearing than traditional hearing aids. Just listen to these situations and hear the difference.
So now let's look at some patient testimonials. And it looks like we're not getting sound through on the virtual. So if we can have technical take care of that, please.
I started doing something that I found was very isolating, and that was to stop asking. I just tried to guess what someone was saying. And then you come up with those kind of answers that could answer anything like, oh yeah, or you have no idea what they said.
Asking people to repeat things when you're looking right at them is pretty embarrassing. And it just got to the point where I knew I had to do something.
Day that I found out about Earlens. It just changed everything for me. It really was the answer that I was seeking.
It's a different system because you have these ear lenses in your ears. There's an actual device that is placed on your eardrum, and that device is I'll just call it a little motor, and it actually vibrates your eardrum.
Earlens is that technology improvement that I've been looking for.
After getting my brand new Earlens, and I immediately turned the radio on to my favorite music, and I just sat there and tears, I mean, literally tears just came down. I told many people, I said, I got my hearing back.
I was walking from the kitchen through the living room, and I stopped because I heard an unusual noise. I couldn't figure out what it was. It was my feet compressing the carpet. This is something you can't express to someone.
When my grandkids were talking softly, and I said, now, why would you say that? And they all kind of went, well, Pops can hear now. It's a whole different world for me.
Now I know that when I walk into any situation, I'll be able to hear what's going on. And prior to Earlens, I could walk into any situation and wonder whether I was going to hear anything or not.
They have gone from obscurity and reclusion and isolation to hearing all these sounds again. Described to many people. On December 29th, I had my second birthday.
From the first moment I got them, I was hooked to Earlens. There was no way I was going to go try something else. This is the way to go. They're worth every penny.
I'm hearing things now that I haven't heard in 10 years. It's been fantastic.
I don't recommend things to people unless I really believe in it. And I don't think there's anything I've recommended more frequently than ear lenses to people that I know. There is no reason to postpone this decision, and there is no reason to not make the right choice, and the right choice is ear lens.
So let's look at some patient outcomes based upon this. And that are patients that are utilizing the Earlens hearing system. And similarly, you remember seeing the audiogram that we presented earlier. Well, here we have a representation of a collection of patient outcomes. And I'd like to ask Dr. Wazen to come back up and comment on this. This is a collection of some of the patients that have been fit here as far as on the average for benefit that those patients have received by using the ear-lens system. So just to describe this briefly before Dr. Wazen gets here, the lower line represents the average patient's hearing loss, and the upper line is the average with the amplification from the ear-lens hearing system. Dr. Wazen?
Well, all of these measures and results were the hard work of Dr. Brennan here, Carolyn Brennan. She's the audiologist who has put it all together. She's the one who has programmed those devices and help us collect all of this data. And as you can see in here, this one. So this is the audiogram here before amplification, and you could see how it gets worse in the high pitches and high frequencies. Your normal hearing is up here between 0 and 20. That's normal adult hearing between the 0 and 20 line. And this is somebody who has been fitted, and after being fitted, this is where the thresholds are occurring, very close to the normal line. And most importantly is the gain here in the high frequency. That's where this system is much more beneficial than a regular hearing aid. Now, not everybody needs an ear lens. Not everybody is a candidate for an ear lens. Most of our patients just get regular hearing aids. They don't get ear lens. But ear lens is specifically beneficial for those people who have the steep, high-frequency hearing loss, where we believe that the ear lens would be better than the hearing aid, or to people who are using a regular hearing aid and are recognizing still the deficit in those high frequencies. Callan, do you need to say anything more about this? No? Did I summarize it correctly? Okay.
Thank you, Doctor. So some of the subjective results or comments from patients that have been fit with ear lens, some of the comments that they make are that voices sound like they should, that they experience a fuller, more richer sound quality. You know, Dr. Wazen spoke about the high frequencies that ear lens is able to deliver, but also ear lens is able to deliver the low frequency sounds as well, without having to occlude a patient's ear. So the ear tips on the system are very open and comfortable. It's a soft material, but because we're directly driving the eardrum, we don't have to occlude the ear or plug it up to stop things like whistling and feedback, but also be able to deliver the low frequency sounds that balance out those high frequencies. So specifically, this addresses sound performance with things like music, because with when you are only amplifying high frequency sounds, it can sound tinny, right? Or it can sound uncomfortable, not natural. And it requires that lower frequency sound to balance it out and round it out. And because ear lens is able to amplify from 100 hertz to 10,000 hertz, which is across a broad frequency range of sound, it creates a very natural sound quality. So live performances, I'm not surprised that patients are saying they like how live performances sound and how music sounds and how comfortable the custom ear tip is, because it's a very comfortable and open fitting. Another patient made the comment that ear lenses by far made the most significant improvement in their daily life than anything else over the past 5 years. When asked of one patient, they said, "My wife, children, and my godchildren, I'm hearing them better than before. I'm hearing conversations better at restaurants. And with that broader frequency range and clarity for those speech signals in speech sounds in words, that makes sense. So what is the process to determine if you're a candidate for the EarLens hearing solution? And this is something I'll ask Dr. Wazen to talk with me further as I describe this and provide any additional input. But the process is pretty simple. First, you come in for a consultation. If you haven't had a recent audiogram, you'll need to have an audiogram with an audiologist to determine your type of hearing loss. But you'll sit down with an audiologist or a hearing instrument specialist and have a consultation to learn about the technology and determine if you're a candidate. You'll also meet with a physician like Dr. Wazen to determine medical candidacy for that. The next step is we go to getting impressions taken, and this can only be done by an EarLens trained physician who's trained in the procedure to take deep ear impressions. Once that's done, the system takes about 2 weeks to make. Every EarLens system is custom for every patient and for their each individual ear. And that is all developed and built right here in the US in California is where we build these systems. So about 2 weeks later, we have the system back to the clinic. And so in about 2 to 3 weeks, you'll have a follow-up visit where the physician will place the lens. And once the lens is placed, then you go back and you see your provider where they're going to do the initial calibration to make sure that the system is working properly and do the programming. If you're a current hearing aid user, that's kind of like your first fitting. Dr. Wazen, would you like to provide any additional comments on that flow and process? And we do have some questions. So as we see some questions coming in, I might go to some of those.
Yeah, so, once we determine candidacy, audiological candidacy, which number one, the audiogram fits this need. The patient actually is interested in hearing better. Then we have to determine whether the ear is a good candidate. So we have to look at the ear and make sure that we have an ear canal that is not too tortuous or too narrow, so we could fit what we need to fit in there. If we decide that the anatomy is appropriate and the audiogram is appropriate, that's when we take this mold. And the mold is like silly putty that hardens. So we will put that silly putty down all the way to the level of the eardrum and then all the way back out the canal to take a mold of the whole ear. That's done in the office downstairs. There's no anesthesia, there's no injection, there's no cutting, there's no blood. So we take the mold and then as the mold solidifies, we then extract the mold and examine it for proper mold. If we are happy with it, we put it in the box and send it to EarLens, and EarLens will manufacture the lens part and the processor part. When I get those back a couple of weeks later, then we get the patient back, and then I will place the ear lens on the drum, and it stays there. This is not something that you're going to take out every day. Once I place it there, it stays there until I take it out. And I don't want to take it out. It stays there for as long as, it stays there. So you're going to shower, you're going to swim, it stays there. And Ken will tell you how we manage things to make sure that it does not get dislodged or it does not get blocked or something like that. So after that, I'll see you every 3 or 6 months just for wax management, make sure that the ear is fine if there's any wax. I don't want you to use any hearing, Q-tips in your ears. That's absolute no-no. It's a no-no to begin with, but it's more of a no-no when you have a system in your ear, because then you could push wax against the ear lens and get into trouble. So we don't want that. So whoever has an ear lens and whoever else, just throw away your Q-tips because they cause more harm than help. You could use them for the outside, for your makeup, but not inside your ear. So, that's it. That's my role. And then it's all programming with our audiologists and dispensers.
Thank you, Dr. Wazen. So like with other hearing loss treatment solutions, there is an investment that has to be made by patients as far as the cost of the system. And so it's always good to go over and educate people on what those expectations would be. And the ear lens system, the system for a binaural fitting, if you're a candidate on both ears, is $12,000 for the pair. There is financing available that does reduce that down. And for patients who have participated and have attended the webinar, we have a special that we've reduced this based upon because you're attending this event. So there is some cost savings with that. But I did want to address some questions specific to that we've had come through. So I'm going to skip over to some of the questions that have come through. We have some that have already been loaded as we've been talking about this. And so I want to be able to address those. And then we also have some in the chat. So we'll go through these. And so Dr. Wazen, some patients have asked, can I feel the ear lens when they're wearing it?
Most patients do not feel the ear lens when they're wearing it. We've had a couple of people who felt that the ear is a little muffled or plugged when they do not have the processor on, but the vast majority of people have no discomfort with the ear lens sitting in their ear. Just like when you're wearing a contact lens in your eye, you know it's there, but it's not a big issue.
We have another question that was asked, do they need batteries? Do you have to change the batteries? And I'll answer that one. The ear lens contact hearing solution is fully rechargeable. So the batteries, you don't have to change batteries. The batteries are housed in the system. You're provided a charger, and with about a 4-hour charge, you get about 16 hours of use throughout the day. And that includes streaming time. So if you're using the ear lens hearing system to pair with your smartphone, you can actually hear those phone conversations directly streamed into your ear lens system, as well as music can be directly streamed into your ear. Another question. So it can be connected to your phones.
How about TV?
TV, we do not have a system at this time that streams directly from a TV. However, you can use some of the phone systems allow you to do a live listen where you can place your phone when you're watching TV closer to your speakers, and then that would stream through the live listen to your hearing system. Can you get it wet? Well, like Dr. Wazen mentioned earlier, the internal portion or the lens that the physician places on your eardrum doesn't ever come out. So you could swim. If you're a daily swimmer or you like to swim in freshwater, rivers, streams, places like that, we do recommend that you get some swimmer's plugs, which can be taken and manufactured from the same impressions that we took to make your system. So you don't have to get an extra set of impressions to have swim plugs made. But if you're just casually swimming in the pool, occasionally like to take a dip, no problem. And Dr. Wazen, how often do you usually recommend having the lenses checked?
As I said, usually 3 to 6 months, depending on how active your ear is in wax production. Some people make no wax at all, and some people are very active wax makers. So I would say 3 or 6 months, depending on the person.
Great. Thank you, Doctor. I'm going to go over a couple of these questions that we received through some of our virtual attendees. We've already addressed the questions about swimming. Some additional questions there. Any problems with flying or with air travel when you're wearing your ear lens system?
No. No problems flying. I think that I do not know of anybody who has been dinged with security. But I know people with cochlear implants, they have a card that says, I have a cochlear implant. So when they go through security, they could show that card. I don't think that this is needed with earlens, is it?
No.
No.
It's
so-
not.
So you could go through without being noticed, unless you carry a gun.
There was another question about telecoil compatibility. At this time, the earlens system is not telecoil or loop compatible. Another question with Android. At this time, earlens is not does not pair with Android devices. We do pair with the Apple model devices. And a question, doctor, does earlens have any effect on tinnitus?
The quick answer is yes, because it's enhancing your hearing. And it's enhancing your hearing in that region where your tinnitus is generated. So earlens or any other hearing aid does not do anything particular to tinnitus itself, but the reason why it enhances or improves tinnitus is by bringing in sound into the system that would internally mask the tinnitus. So yes, if you have tinnitus and you have hearing loss, wearing a device that brings in those frequencies from externally into the ear helps suppress and mask your tinnitus.
Another question, does earlens stay in place 24/7? And Dr. Wazen discussed this earlier, that once he places the lens, it does stay unless he determines a reason to take it out. So it does stay in place. The processor and the ear tip, just like a current acoustic device, you would take that off if you're going swimming or when you go to bed, and then put it on the charger so it's ready to go for the morning. And just like any other hearing loss treatment solution, you want to wear it, throughout your day when you want to hear better. Another question about, it's stated, so you need continuous follow-ups. Well, just like traditional acoustic devices, most patients see their providers on a regular basis to determine, one, that the system is functioning the way that it should. You've invested a lot of money into a hearing loss treatment system, and you want to ensure that it's working properly. But two, your hearing loss may also change over time. And so it's good to work with your provider to ensure that the system is delivering the performance that you'd like to see from it. Another question, doctor, does it work with single-sided hearing loss, sensorineural hearing loss?
The concept of single-sided hearing loss, meaning you're pretty much deaf on one side and you have good hearing on the other side, those people do not have enough nerve cells on the deaf side to be stimulated by earlens or hearing aids. Most of these patients with single-sided deafness either need a cochlear implant in that ear or a cross system. And the cross system is the one that would transfer the sound coming into the deaf side, transfer it to the opposite ear in a cordless fashion, so that the good ear is hearing what's coming into the bad ear. So that's for single-sided deafness. By definition, those who do not or cannot benefit from amplification. But there are different levels of single-sided deafness. So there are people who have single-sided deafness, but who have a discrimination score, or their word recognition score is at 50 or 60%. Those could benefit from earlens. When we're talking about profound or total single-sided deafness, those do not.
Thank you, Doctor. So we have reserved some special consult times available next week here at the center for those of you who are local to the area on May 16th, 17th, and 18th to be able to have a consultation with the provider to determine if you're a candidate, but also to learn more and additional information. You can call the number that's listed on the screen to schedule a consultation time with the providers here, or you can scan this QR code that's on your screen using your smartphone to schedule a virtual consultation with one of the Airlens hearing advocates who can answer any additional questions that you may have. I'm just going to scroll through the questions real quickly and just make sure we haven't missed any. And it looks like we've addressed all of the questions that have been listed virtually. Oh, there are more. Thank you. Let's get to the Q&A here section. Hang tight. Okay, we do have a few more. Dr. Wazen, a attendee requested some more information about bimodal options for cochlear implant recipients.
That's a great option. So patients who are cochlear implant candidates are known to have hearing loss on both sides. And hearing loss to a level, to a degree where the regular hearing aid is not enough. So once we implant one ear with the cochlear implant, we like to continuously stimulate the other ear somehow. And it is my preference that the opposite ear could be stimulated with an ear lens instead of a regular hearing aid, just because the severity of the hearing loss in that opposite ear would probably respond better to an ear lens. So there is a possible application there, either with a regular hearing aid, a powered hearing aid, or with an ear lens.
Another question, Dr. Wazen, what happens if the patient has a perforation of the tympanic membrane and they use the lens?
We do not like to put a lens on a perforated eardrum. So if there is a perforation, then we would prefer to seal the perforation, because even with a regular hearing aid and a perforation, you are at high risk of having infection and drainage and so on. So if there is a perforation in the eardrum, it's better to seal the perforation, close it, let it heal, and then we could put an ear lens or we could put a regular hearing.
And a question about the types of audiologists that can work with the Earlens hearing system. They don't have to be, there's not a special type of audiologist, but they do undergo specific training with the Earlens field audiologists and training teams to give them familiarity on the system and the software to manage them. So Earlens can only be purchased or dispensed by physicians and audiologists who have been trained in the procedures. And there was a question as far as on the payment plan, the minimum amounts to pay. There's really, the financing could go up to the full amount. There's not a minimum amount. However, there is typically a non-refundable portion, which just covers the time and supplies and equipment to produce the ear impressions and the initial appointments to cover the lenses. So that is typically there is a small portion of the total that is non-refundable. And I don't see any other questions, Dr. Wazen, coming up on the in the chat or on the Q&A section. But I will remind you, we do have specific consult times set aside with the audiology team here to go ahead and have complimentary consultations. So those of you who are here, we can schedule those on your way out. And those of you who are attending virtually, please call the number listed on the screen, or you can scan the QR code that's listed. Thank you very much to everyone. Thank you for the Ear Research Foundation. Oh, we do have some live questions. Oh, as far as question, yeah, that's right. So- So there, okay, so I'll tell you exactly how that happens. So the ear lens is placed by the physician down on the, in the tympanic membrane at the sulcus area of the ear canal, down on the eardrum. That portion of the system, which is the lens, is not self-powered. It generates its power from the inductive signal that is being transmitted by the ear tip worn in your ear. And so it doesn't have, the lens gets its power and instructions from through that source. So it's not powered. The lens itself doesn't have batteries, and it's a very, very, very small motor. I'll show you an example of that live, of what the size of a lens is. That's correct. So the system is comprised of three main sections, three pieces, but two are connected together, just like a traditional acoustic device. That's right. So the lens is placed down on your ear. So on the eardrum, yes. The portion that actually touches your eardrum is only about 2 to 3 millimeters in size. The rest of the lens is touching an area of your ear canal called the sulcus to hold it in place. It just gently sits there with surface tension. Correct, but it's not, I wouldn't call it permanent. It can be removed, but it's not something that is taken out on a regular basis. The exterior, absolutely. Yep, we do have materials that you can view to answer more questions, and I'm happy to answer more questions for you. That depends upon the practice and the providers, so of where that is. Yes, yes, sir. Excellent. Well, I'm glad you're interested, and you'll need to speak with your audiologist, and we can help coordinate a consult. Sure. And I'm going to repeat the question just so that those that are virtual know what I'm answering. So an attendee here has asked if your hearing changes over time, if anything physical has to change. Not necessarily, no. Typically, when your hearing loss changes, that's why regular visits with your audiologist are important, because they're going to test your hearing, and then the software, so the programming of the device, can be updated to match your new updated audiogram. So that's why it's important to work with a provider on a regular basis, no matter what type of hearing loss treatment you have, because your system's not going to be working right if it doesn't have the right instructions. And the instructions are given based upon the data inputted by the audiologist from your audiogram. Well, it stimulates your brain, yes, because it's stimulating your natural hearing process mechanically at the TM. So, yes. And ma'am, did you have a question? Yes. That's right. Your audio, based upon your audiogram, the audiologist can program it specific to your custom type of hearing loss on both sides. Yes, sir. Yes, there's been a number of studies that link untreated hearing loss to increased balance issues. And I'll let Dr. Wazen address that further with some more detailed information for you.
No. So, yeah, so you need to look at this as a hearing solution. Now, the inner ear is an organ of hearing and balance. And those people who have had long-term degeneration or degenerative changes in their hearing may also have degenerative changes in their balance system. And therefore, patients who have hearing loss could also have balance loss. Now, for not completely understood reasons, but theoretical reasons, statistics show that the risks of falls are higher in people who have hearing loss. So same age, same circumstances, hearing loss untreated, your risk of fall is higher. Now, why is that? Because the hearing aids are not doing anything with your balance system. They're improving your hearing. However, it is believed that when you have better hearing awareness of your environment, that's going to help you better balance yourself than when you are, hearing impaired. And that may be one of the reasons why balance is better with better hearing. But there's nothing that these devices are doing to improve your balance. They're not going to stop your vertigo. They're not doing anything for your balance. They're making you hear better, so you'll have better awareness of your environment. So physical therapy is a very important method of enhancing balance. And how does it work? It's by pushing the brain to compensate for weaknesses and losses of function. So there's a specific type of physical therapy called vestibular rehabilitation therapy. This is a subsection of physical therapy. So if you go to a regular physical therapy place, they're gonna do things that are not completely what we're talking about. Vestibular rehab, which is a neurologically based physical therapy instead of orthopedically based physical therapy, is what we use to enhance people's balance. Not for everyone. Physical therapy or vestibular rehab will not stop you from having Meniere's vertigo attacks, but it will help you with your day-to-day balance so you don't trip and fall. So, physical therapy and vestibular rehab therapy is a valid way for us to treat balance disorder. So don't discount that. Any other questions? Because he has to leave. Not yet, right?
Not yet.
They're working on the loop part. Well, if you're going to take off your processor when you go to sleep, then the lens is just sitting.
So the lens itself is not powered. And so in order to give the lens its instructions on what to do, and in order to have the power to move your eardrum, we have to have the external portion, which is a processor with the ear tip that is delivering those instructions and the high fidelity sound instructions to the lens.
The question is, if you've had multiple surgeries on your ears, otosclerosis, etc., so you have a fenestrated ear. So this you're a historical figure here, because we stopped doing fenestration, what, 60 years ago, or so. So if the ear canal and the eardrum are intact, then it is possible to use an ear lens. If you have a mastoid cavity, like a fenestration cavity, you cannot do that. Yeah. But if you have an ear that has a regular ear canal without the mastoid opening, we can put an ear lens in there as long as there's no hole in your ear. Any other questions? Yeah. All right. Well, there's some dessert there. Enjoy some. Take some to your friends. And yeah, it was good. That tiramisu is very good. Did you try the tiramisu? Did you try the tiramisu? Dessert. Yeah. Okay, good. Good.
Thank you, Dr. Wazen, and thank you, everybody, for joining us, both live here and also virtually. Thank you and have a wonderful afternoon.